welcome to everyone who's joining us tonight. So welcome to another live Q&A session with the Young Black Physicians. Tonight, we plan on talking about how COVID-19 has impacted the Black community and different marginalized communities, as well as give you all updates on vaccines and answer any questions that you have, whether it's about, hesitancy, different things like that. So again, welcome. Just a few, and I'm Dr. Elizabeth Johnson. I'll be your moderator for this evening. I am a pediatrician here in the greater Metro Detroit area, but I just want to take care of a few housekeeping rules tonight, okay? So first, we are not receiving any gifts or payments from pharmaceutical companies, biotech companies, health institutions, or any other private or public institution for today's event. This event will be recorded for educational purposes, and by participating in the call today, you are consenting to this recording and potential published educational evaluations. All of the information shared here will solely reflect the views of the panelists, and this will include the panelists' research of nationally available information, as well as the panelists' own personal experiences. The views expressed in this video are not representative of our associated institutions. This is not to be taken as strict medical advice. All content, including text, graphics, images, and information contained on or available through this platform, is for general information purposes only. So as always, please talk to your doctor or qualified healthcare provider for more information. Like Dr. Evans already, kindly mentioned, there is, if you are not familiar to Zoom, there is a question or a Q&A tab that's along the bottom of your screen. We ask that you direct all of your questions to that area. Throughout our panel discussion tonight, we will have some of our panelists going through answering your questions, and then someone will be also feeding me questions so that we can get to as many as possible tonight. We ask that we reserve the chat section to, like, if we're having technical difficulties or if there's something's going on, you could put your concerns there, but we will try to get to as many people as possible tonight. If you find that your question is not getting answered, I promise that we aren't missing you. We're just trying to sort through everybody's concerns. So let's get started. I just wanted to say a quick, little introduction before I introduce our panels. But I know over the past year with the pandemic, it's really only magnified and opened the nation's eyes to many medical health inequities and really has challenged, I know, us to implement strategies in our communities that will address health disparities and to achieve health equity. So the charge to public health professionals is just as critical now as it has ever been in the past. So we're here to really shine a light on those social factors that help construct patterns of health disparities. The population health impact of COVID-19 has exposed in plain sight things or inequities that have been in place over decades, that have systematically undermined the social, emotional, and physical health of racial and ethnic minority populations. And you can just see that in the data. So some data that we want to present tonight. So of the more than 520,000 cumulative US deaths cataloged, about 73,236 of those deaths are Black Americans. So 1 in 555 Black Americans has died. So we really want to highlight what are some of the roots of those disparities. And we know one of the main themes and topics that we're going to be talking about tonight is how racism, not just race, is really a driving force behind COVID-19 and some of the health disparities that we've seen. So I don't want to take up any more time. Let me introduce our amazing panel tonight. First, we have Dr. Jannel Lee Allen. She is a Gastroenterology and Hepatology Fellowship here in the greater Metro Detroit area. Welcome. We have Dr. Cindy Agu. She is, hey, twinsies. Okay, she is a neonatologist practicing also here, or a neonatology fellow practicing here in the greater Metro Detroit area. We have Dr. Jeremy and Jermaine Hogstrom. They are both practicing here also in the Metro Detroit area. They are internal medicine residents. And then we have Dr. Amel Okoye. I got it right. He is trained in pediatrics and medicine and is practicing in the New York City area. Then we have Dr. McPherson and Dr. Uroda that you see down at the bottom of your screen. They are our family medicine physicians. And finally, we have Dr. Kenisha Evans. She is an infection disease control, epidemiology, and antibiotic stewardship fellow. So she's also here in the greater Metro Detroit area. Welcome, and let's get started, guys. So I know that the way that tonight is going to work, we have a lot of things, a lot of questions that we had from our last Q&A panel. If you didn't watch that, that is on our YouTube channel. But some of those questions, a lot of them focus around the theme, like I said, of health disparities and racial inequities that we are seeing. So the first question I want to get into that was from one of our viewers is, what advice can you give to African Americans that have distrust in the healthcare systems? I know Dr. Uroda and Dr. Evans wanted to touch on this, so if you guys want to get started.
So what I tell a lot of my patients, because this comes up a lot, is be your best advocate. You know, we are working in a system that is unfortunately going to take time to change. You know, this is not an overnight process. And that certainly doesn't mean to just settle and sit with what we're working with, but understand the reality of what it is and go where you're celebrated. There are websites like Health in Her Hue, where you can be linked to physicians that are more representative of, you know, Black females. If you want to find a certain demographic, that there are plenty of outlets and resources for that information, because I think it's very important to find someone that you can trust and, you know, have your voice heard, have your concerns and medical things addressed. And that's how I feel is one of the best ways to address, you know, the current situation that we're in.
I agree with what Dr. Uroda is stating. And the reason that it's important, everything that she just talked about in terms of being your own advocate, is because when we think of this climate that we're in and how when it comes to the Black culture and medicine and this distrust and just the understanding of how we got here, how we got to a place of hesitancy, how we got to a place of not trusting our healthcare system, understanding that history. I know that just with looking at the media and how this timeline has played in terms of vaccination, and one of the marquee things that we discuss is the Tuskegee Tuskegee syphilis trial, and what that actually meant. We all understand it as these were all over 600 African American men in Bacon, Alabama, that were not or misinformed that they were being treated for a underlying illness, when in actuality they were just being followed for disease severity. But it doesn't just stop there. That was just a piece of the circumstances that arrived during that time. And although that was the most publicized, there were a plethora of other circumstances. I actually, in my own studies, believe that Black people were the foundation of what we understand as science and medicine, because we were their guinea pigs, as something that my uncle utilized when I first introduced the idea of him being vaccinated. He said, I didn't want to be anyone's guinea pig. And unfortunately, during that time, it was the US Public Health Services that orchestrated the dynamics of this study. And even after they were publicized, those individuals were still followed. So we're talking about something that began in 1932 to end in 1974, 75. And then those patients' samples were still being followed. But one of the things that I feel that tests to this time is the fact that you have a community of physicians, not only us as the young Black physician group, but you have a lot of African-American physicians that are stepping up to the plate and says, you know what, I'm going to change this narrative. I'm going to listen to what's going on. I'm going to be that mouthpiece of understanding what is the science, what are we doing, and how can we rectify our disparity. And that's what made us come together as a collective. And I feel like that's what is the narrative now. I mean, a lot of the initiatives across the board are understanding that the diversity is not just the racial understanding of what makes us different, but it's understanding that we are individuals, and it's not this politicized narrative that was the case in those early studies, like the Tuskegee Airmen, if that makes sense.
So, I'm really glad that you brought up that, because I think that no matter what specialty we are in, myself with pediatrics, family medicine, internal medicine, that we've all heard that, or the reference to the Tuskegee trials in terms of hesitancy and skepticism towards the vaccine. So what can we do in our community to try to dispel some of those myths and to gain our community's trust? Anybody can take that.
I think what we're doing now, like having panel discussions, taking time outside of that one-on-one conversation that we have with our patients in the office, and actually presenting the information in what we understand, the research that we take time to say, this is what I've studied, this is what I learned. I'm going to present it to a general body, and it not be that that conversation that requires your copay, that requires your appointment time. This is an opportunity for one, you ask a question that you may not be able to get addressed at that 15-minute visit. This is what we're doing. This is our leg to that situation, is being able to present these forums. And whenever else you see another forum, ask your questions. Those questions should be addressed. We're in a season where we want to be transparent, and you need transparency. It goes back to your being your own advocate.
Yeah, and just to touch on that, right, with having these panel discussions, not only does it allow us as physicians to be more critical of what we're reading about, it also allows the public to be more critical in a way that hasn't really been, done before. So one thing that I've noticed is that with all the transparency throughout this whole process, with this pandemic, there has been a lot of criticisms, and there should definitely be those criticisms, because as those questions arise, that's how everybody learns more. And then again, that's what this process is really all about for everybody.
Not only that, is just backing up our words with actions. We are all a panel of young Black doctors that have been vaccinated. So we have that firsthand experience, and, doing our own research and education. I think that speaks volumes when you're really looking at the fact that, okay, we did our research, we trusted enough to get it ourselves. Because I'm not recommending things and treatments to my patients that I wouldn't do myself or recommend to my mother or sister, anyone, So I think that's really important to know about why we're here, what we're talking about, and understanding that, the medical field has to be the ones that they trust.
Even just to add to that, the idea of making sure that it is COVID a year later, understanding that, as Dr. Johnson first started by saying, we are a year into this, over 70,000 African Americans have died due to COVID. And I think the question one of our attendees had asked before was, okay, we've gotten a lot of attention. And specifically, the questions of, well, why are African Americans dying more than other people and more than non-Hispanic whites? And really the question, or the answer, part of that answer was the idea of having a heavier burden of chronic disease, and also having, like many communities of color in America, there are folks who have more urban and more closer, more densely populated housing, particularly in urban areas. We also deal with the fact that there are many and I definitely won't say most, but there are many of folks who are from the communities of color that served in essential workers or in jobs that they had to be exposed, and not just had to be exposed, but also were not getting the initial PPE protection for those essential workers. And that really led to a lot of the first 6 months heavy, rapid deaths for African Americans, as well as non or Hispanic and Latinx Americans, and then later on indigenous populations. But the question of where do we go from here? That's really the question. What do we do next? We have all this attention. And I really want to quote Dr. Kamara Jones, who is one of the chief epidemiologists for the US and globally. But the idea is inaction in the face of need is one of the main things of structural racism. So how do we make sure and demand that we have action and resources? Definitely, as Dr. Evans says, we are coming to the community and we're reaching out to you guys so you guys can bring us your questions and we can answer and get back to you as quickly as possible with trusted and proven sources. But it's also the idea that as physicians, sounding the alarm and making sure that there are policy changes and that it goes beyond just us being physicians. And also for you guys who are out there, if you are doing community work, it's about sounding the alarm, making sure that the dollars that our government, as well as if you work in healthcare, if you work in grant funding, that those things get funneled into the places of most need. And this is about, presenting where are we most needed? Like we said, the idea of the heavy burden of comorbidities. So the idea of half of the African Americans who have died who were in the hospital, there was one recent study done by Stanford, showed that they had a heavier burden of hypertension, diabetes, and obesity. So, as young Black physicians, the question of where do we go from here? We have been, being primary care doctors, as well as pediatricians, as well as OB-GYNs, as well as, family physicians. We try to treat those things for our patients and try to make sure that those chronic conditions also get attention. So I think it's, this whole place of having so much attention and so much light. It's the idea of continuing to educate our community. It's the idea of continuing to spread the word through social media and others and through your word of mouth. And it's the idea of continuing to know, even on a larger scale, policy, who we vote for, making sure, we are understanding the different governmental sources that give monies towards your local area and advocating for that.
I really agree with that. And so something that I hear you all saying is that we really are talking about, I know I've mentioned it, but health equity. And then I know if people watch the news like I do, you hear things about vaccine equity. So does anybody want to really touch on what are the concerns of how historic and ongoing racism and discrimination really create barriers to people of color or marginalized communities getting the vaccines or getting vaccinated? Anybody want to touch on that?
So I can start with just a generalization of what's going on is how the protocol, when it was first approved for emergency use, CDC came out with guidelines for who to prioritize, but it was up to the states individually to distribute and plan things. And it's so bad where people are crossing state lines to get this vaccine because the state that they're in, they're not eligible. You can be a grocery store worker in one state and have gotten the vaccine, be number one, but then somewhere else, it's not the same. And it's not good with that type of situation happening because people are, again, doing fraudulent things. And then when you're already dealing with areas of disparity, such as the Metro Detroit area, it's even worse. So, as of right now, to speak on that, actually, New Mexico and Alaska, when you look at population proportions, they're the top two most vaccinated states per population rates. And those are areas where a lot of indigenous Native American populations are at. And that rise that we're seeing with those getting vaccinated was because there was direct, campaigning, direct implementation of just getting that education out about, how safe this vaccine is, how important it is. There were efforts made. So if there was more of that going on, where there was just direct community engagement in these areas where we're lacking so poorly, I think that we would see a lot better turnout. If it was more even across the board, where we wouldn't have this one rule in one state and a different rule in another, I think that uniform might help the situation. But as of now, there's still states like, Michigan opened up where now all are eligible, 16 and up. But there's other states that won't reach that point till May 1st. So that's it's March 29th. So May 1st. Is where some of these areas are going to be finally getting access, where across the board, everyone will be eligible. That's huge.
And just to add to that point, I think using Michigan as a trademark, and I know that the Biden administration have been creating, programs with their rollout in terms of the vaccine and trying to reach his goal of, I think now it's like 100 million or
200 million.
200 million within his first 100 days.
Yes.
And with that initiative, he's had these the things that particularly here in the city of Detroit, like hospitals like DMC and Henry Ford, they have these initiatives that are partnering with nonprofit organizations and faith-based organizations to reach our populations that are having this hesitancy and having conversations within the faith-based communities. I know, like with the NAACP and its president here, they are having now 65 and older Saturdays, where at United Chapel, I think is the name of the church, is and a few other cities within the city of Detroit that are having Sundays dedicated to those over the age of 65, just educating and allowing them to get vaccinated, where they don't have to be a part of the crowds at the TCF Center or any of the local health department long lines. So there are a lot of initiatives across the country that are having that same basis in terms of using nonprofits and faith-based organizations and utilizing the platforms of leaders, which is similar to what was done in times past, where we rely on those that are trusted officials within our local and small communities to be our gauge for resources, not just the African American or people of color physicians.
So I see that, I just want to remind our attendees, for those of you who didn't hear the intro in the beginning, we want this to be an interactive discussion, and we want to make sure that your questions get answered. So please put your questions in the Q&A tab that you see at the bottom of your screen if you are using Zoom on your computer. And I'm not sure if it looks the same on your phone, but we want to get to your questions. So I do see one question from our audience I want to put to our panel. It's from Ms. Lily Monroe. She says, I had both my vaccinations March 4th and March 25th. My daughter had both hers about 2 months ago. When can we get together? Masked up, of course. And when can I see and hold and kiss my grandbabies and her children? Who wants to take?
This is so exciting, right? CDC guidelines say that you can gather without a mask among those who are also vaccinated, fully vaccinated. Okay.
For 2 weeks.
For 2 weeks.
Yes. So
no, you just answered. That's what I said now. So yes, you're fully vaccinated. Your daughter's fully vaccinated. According to CDC guidelines, it is safe for you to hug, kiss, interact. I miss you, whatever.
Make sure she's saying. Sorry, I just want to. So she's saying that her vaccine the second dose was the 25th. So you have 2 weeks post the 25th is when you are considered fully vaccinated. For Pfizer and Moderna, 2 weeks post that. So 2 weeks from the 25th is when you would say, I am fully vaccinated. For if you receive Johnson & Johnson.
April the 8th, Ms. Monroe. April the 8th.
April the 8th. Would be
give hugs, kisses, share some ice cream, stoking.
I don't know about
She
sharing
said
ice cream.
masked up. She's
I don't
still
know
saying
about
masked.
sharing ice cream with the kids.
I said I'm just
They
joking.
carry all the germs, but
I would still be very, very cautious in doing so. But we're talking about with others that are 2 weeks post their vaccines. Anyone else, you should still be wearing a mask, washing your hands. We should be washing your hands, period, in general, because it's just not COVID that we need to stop with not washing our hands.
Right.
But also with wearing a mask and social distancing, anyone that is not of your family or have had that 2 weeks post their last vaccination dose.
So Dr. Evans made a good point. You know, of course, we want our community, our family members and friends to get vaccinated. But once you are vaccinated, waiting that 2 weeks after, you know, both vaccines, and it's also not a freebie to just go out and, you know, have your mask off and doing what you want. Not quite yet. So I think, you know, we constantly hear this. I know I've heard it when I've been listening to church, all that jazz of, when can we get back to normal? When can we get back to normal? We aren't going to get quite back to normal yet. We have to adjust to this new norm. And that new norm, we're still going to be wearing masks. But if you are in a group that everybody's fully vaccinated, 2 weeks post that second shot, you all can get together. So I see our next question from Kelsey Bolton. What do primarily white physicians in a primarily white community with a small and underserved Black population need to know? That's an excellent question. Who wants to take that?
I guess I'll start it off here. Yeah. So, you know, I think to start, it's always important to understand, of course, the population that you serve, and of course, what do I mean by that? You know, it's understanding, first of all of the social determinants of health, everything that goes behind your patient as a person, their life. You know, everything from the prejudices that they may be facing, to their living situation, to their, you know, everything from their job to their schooling situation, you know, what's going on with their kids, starting there, and then understanding what life situations they've experienced because of these situations or any priors, you know, situation that may have occurred. Because of course, you know, as you know, these things take literally direct effect at their health from their environment. You know, as you know, for example, you know, kids that have not even with COVID, but other risk factors. You know, let's say asthma or other lung diseases that are caused by their environment, right? So if you live in an environment that has a lot of pollution, typically inner city, things like that, then of course you have to understand, you know, the risk factors that they may be at higher risk for certain lung diseases, which then might put them, of course, in this case, at a higher risk for COVID. But starting there would be the basis from my standpoint. Also, I wanted to add that one thing that I feel is very important is also understanding the history behind your patient, understanding what in history may affect their beliefs in the present day. And I know that we did talk about the Tuskegee experiment earlier, but that's just one small, you know, example. So I feel that one very important thing is just understanding the history behind your patients, and then how that will or may affect their decisions. Yeah. Well, I was just also add in one thing that I've learned, even within myself, is that, you know, there are a lot of fears that people clearly have in general about medicine, not even COVID, but just within medicine in general. And when you take the time to sit down and really just understand why that is, you know, not just brush it off and say, oh, you know, they're just being a non-compliant or whatever the case, but truly understand what is their concern. Like I had a patient today in clinic. They were concerned about, it wasn't a patient of mine, but a patient of my colleagues that was concerned about, let's say, you know, being not taking medication because they're toxic and things like that. Well, understand, you know, maybe like, why do they think that? Because you never know. There's a lot of times there's legitimate reasons behind those concerns. And although from our standpoint, we can say, oh, well, we know the research behind this medication or that drug, and we know that it's a fairly safe medication, but not everybody understands that. So understanding why they have that fear and trying to convey to them, you know, what is that you understand about it, again, from your standpoint and the way that they understand the best, often I have found to be very successful too. So.
I know, go ahead, Dr. Okoye.
Yeah, I'll just be really quickly, and forgive any background noise you may hear. I was told there may be an echo. But just to jump off the points of the Hogstroms, Dr. Hogstrom, I just wanted to say that's exactly the starting point you want to really set the foundation for. But honestly, you want to have a candid conversation. The issue that sort of put us in this predicament now is a lack of trust. And so you want to make that acknowledgement with the past issues, but then you want to speak in a candid form, really saying that whether you are whether you consider yourself culturally aware, culturally sensitive, just being open and saying, I don't understand some of the factors or the issues that you deal with, and I really want to be more aware of them. Can you help me to understand? And then once you build that level of trust, you can you see that they will acknowledge that you care and want to see them benefit in their own lives. And in that point, when they see those things, you can then start making suggestions. You can start advocating for them and showing them ways that they can improve their lives, and they will take you earnestly and seriously. So that's all I wanted to add.
So those are great points. I'm sorry. Go ahead, Dr. Lee Allen.
I just wanted to add a quick quote that I think really nicely ties everything in. There's an old saying that says, people don't care what you know until they know that you care. And I think that goes for any and everybody.
I definitely agree with that. Something that I would say to my white colleagues and white peers is that an understanding that racism, not race, drives the inequities that we see across COVID-19. Racism, not race. So very often in our medical training, I don't want to speak for everybody, but we hear it. We very often hear, instead of race being seen as a social construct, which it is, race is seen as a biological type of tool, and it's not. Race cannot be equated to genetics. It's not the same thing. So very often I feel like physicians who are not of color have a very hard time of recognizing how we have taught and the things that have been passed down along generations are rooted in systemic racism, right? So, and it affects how they treat communities, especially marginalized communities. So they may dismiss certain issues or certain problems, and that is going to directly affect their patient's care. So that's very, very important. We see it all across medicine. And the issue of racism, it doesn't just come up when someone says a slur or something that's very overt. It can be covert. It is pervasive, and it's embedded in our community, and it's a permanent residue. So taking the time to listen, actively listen to your patients, their concerns, and not dismiss them would be very helpful, because racism definitely is, what's the word I'm looking for? It shapes the factors, and Dr. Hogstrom mentioned this earlier, but there's social health determinants that are definitely playing a role in our underlying health conditions, things like underlying health conditions, dense living conditions, employment in certain service industries, all that jazz. So that's something that people really need to keep in mind. But I want to keep it moving. One of our other questions that I see from the audience, it says, I'm considering taking Gini the Johnson & Johnson shot. I want to see, which one do you recommend?
So
take that.
I can take that. I think I can take it, and as well as Dr. McPherson, Dr. Uroda want to talk about that too. I think any vaccine that you take is okay. I am one of the only members in the panel who got the Johnson & Johnson vaccine. But they pretty much have similar reactions. With the Johnson & Johnson, they do have different efficacies though. We do have a 67% efficacy with the Johnson & Johnson, and then a 96, 97% with the Moderna and the Pfizer vaccines. They're both going to help prevent you from getting the severe or moderate symptoms of COVID. So they're both good vaccines. It's gonna kind of be difficult to choose which one you want, because a lot of places that are administering the vaccines don't really kind of publicize which ones they're giving. So whichever vaccine that you could get, I would recommend just getting.
Actually, at this point, though, Dr. Agu, the TCF Center as well as the Detroit Health Department have given you the ability to request which vaccine you want. Although it is recommended to get what is first available to you at this point. I think as far as last week, it's been in a place where you can actually choose which one you want. Again, just to echo what Dr. Agu has said, one is not superior to the other. There is no head-to-head clinical trials comparing one versus the other. They were done at different time points within this pandemic, so it is hard to decipher one being better than the other. They are all very much so efficacious in the sense of preventing you from being severely ill by COVID, which is the goal. Preventing you from being hospitalized is the goal. So you do have the luxury at this point, though, to choose which one, which is something very high to that point, because places outside of the US are just waiting for the opportunity to be vaccinated.
Anyone else want to add anything before we move on?
Yeah, if you don't mind, I just wanted to add, I know that there's a lot of talk about, the Johnson & Johnson vaccine is not as effective as the other two, but I just want to drive the point home that when in the trials with the Johnson & Johnson vaccine, that again, people that received the Johnson & Johnson vaccine, none of them, there were no COVID-related deaths from COVID, and those that received the vaccine. So again, I just want to drive that home that although the percentages are slightly different, and to be honest, even that the percentage for Johnson & Johnson is really, really good compared to traditional vaccines. Again, there were no COVID-related deaths in the trial for those that did receive the Johnson & Johnson vaccine. So.
Very good. So our next question I see, it says, I have now been fully vaccinated. My brother and sister are hesitant. They are concerned about possible long-term negative effects of the vaccines that would be unknown. What do you suggest I say to encourage them to get vaccinated?
So this one was something that I had a little concern with when I first was trying to decide if I wanted to be vaccinated about, okay, this is a new vaccine, right? Or, what happened to this long timeline that they told us about that a vaccine was going to get made? Why are we now getting it so quickly? So I had to do research and found that, mRNA technology has been around for a long time, since the 90s. So there is a lot of evidence supporting the use of this type of vaccine. It's been used to generate different types such as Epstein-Barr, rabies shots. So that was at least comforting to know that these are longer trials that are being done. Of course, we cannot say with complete certainty whether or not there are going to be some type of long-term effects, but as of right now, we're not seeing any. And a lot of data is very strongly supporting that there won't be any. This is one of the safest vaccines that we've ever seen. Vaccines that have been given for years do not show this strong efficacy, percentage-wise. So that's some comforting things that I would share with your family about it.
And just to piggyback on what Dr. Uroda was saying, we don't, and everyone that was involved in these studies are going on for the next couple of years. So it's not like it's over, it's done with. They're following all those participants to see about long-term side effects. But more and more data is emerging, like Dr. Uroda said, that these vaccines are safe, even in pregnancy, even in women lactating, that these vaccines are very safe. But on the other hand, what we can say is long haul syndrome. It's called COVID long haul syndrome. People who have contracted SARS-CoV-2 early in the pandemic, COVID-19, are still having symptoms. We're all, especially us clinicians, we're all seeing patients come in the clinic, brain fog. I had a patient today, literally, she's on Eliquis, and I asked why. She said, oh, I had a blood clot when I caught COVID. She, now she's on a blood thinner. Patients having, daily headaches. I mean, it's just, still having chest pain, still having shortness of breath, and they're doing CT scans and it's showing fibrosis of the lungs. So we know that actually COVID-19 is causing what we call, what the new term they call is long haul syndrome. Don't know if it's permanent, but just the contrary, just something else to think about, as opposed to the long-term side effects of a vaccine that has so far been proven to be very safe, versus taking a gamble or risk and just say, okay, I'll just take my chances and catch COVID and I'll be okay. Yeah, even the people that had mild disease are now having later symptoms. Like, yeah, wait, I had it mild, I didn't have any symptoms, but why am I having daily headaches now?
Or losing their taste. They still don't have taste.
Exactly.
Weeks, months later.
And the other point to actually be made on top of the long haulers is this idea of immunized pressure. So the more people that we get vaccinated, the less likely this virus can replicate and change it to different variants. Now, if as you see in the media, we are hearing stories about the UK variant, the Brazilian variant, the South African variant. That's because the virus has the ability to replicate. And when it replicates in its host, which is us, it doesn't follow any rules or regulations. It can change from being one person to being something else in another person. And for that, when that happens, that its ability to be either more severe or more transmissible, those are issues that occur because we don't have enough people immunized.
And I think I want to add to that. I know that when my family last called and asked me about this one family member in particular, is we try to think about it in terms of passive protection as well as active protection. So the idea of us wearing our masks, staying at home, and staying 6 feet apart, washing our hands, those are all things that we are passively trying to do. We're trying to avoid coming into contact with it. However, the vaccine is actually the ability to allow our bodies to actively formulate white fighter cells that will coil and kill the virus if we should come into contact with it. So regardless if we are 100% perfect, even though we're human, we never can be 100% perfect. If we should come into contact with the virus, our bodies then have their own ability of fighting chance to kill off the virus. So that means that the more of us who actually have active, strong antibodies, and the vaccine has been shown to be stronger than actually natural infection, meaning those people who get it, or if you've had it already, this vaccine has been shown to have a better immune response and to create a better army of white fighter cells against the virus, so that if you come in contact with it, despite all of the things that you've done, that you are actually able to fight it off, kill it, and not continue to spread and spread. We don't have the exact data on spread because we didn't study that as a part of the clinical trials. So there is a question of whether if I have it, my body is fought it off, can I spread it to others? We want to let you know, and as always, YBP is going to be very honest, we do not have the data behind that. What we do know is that the vaccines have shown to be very efficacious to the point that we can avoid severe disease and death, right? Those are the biggest things. That's why we're still wearing our masks, because you could possibly get it. Maybe it's only for a day or so. Your body is able to attack it and knock it out like that. And someone else who's not vaccinated may not be able to do the same thing. So again, passive versus active.
That's actually a great segue, Dr. Lee Allen, into the next question. From Mr. Clark, it says, is there any validity regarding the assumptions that people that are vaccinated can be carriers or possible transmitters of COVID? Specifically, can someone who has been vaccinated still contact COVID?
I can speak on that. So Dr. Lee Allen actually made the point that we aren't 100% sure whether we don't have enough data to suggest that once you're vaccinated, you are not going to be able to acquire COVID, the asymptomatic form of it, and still pass it on. But the science, and the only reason we don't have much data is because when these trials were being put in for the mRNA vaccine, that's the Moderna, and for the Pfizer, this is not one of the things that they were looking at, the focus on. Their focus at the time was mainly, how are we preventing death? Are we preventing hospitalizations? So right now, they're actually retroactively, or at this point, going back and seeing, okay, how is it looking now in terms of, are we still able to transmit? So there is some data actually. There's not a lot to go off of to make guideline changes, but there's a lot of good things showing One with the J&J. So I was speaking on the Moderna mRNA vaccine, but with J&J, they actually did look into that thing. And they have about 74% chance or 70% chance of decreased transmissibility. So they looked specifically at it and showed that there actually is prevention after getting vaccination, that you can get a asymptomatic version of COVID and pass it on. So that shows efficaciousness right there on passing on. With the mRNA vaccine, it actually is from information that we're getting from internationally, so from Israel. Their vaccination campaign has been phenomenal, actually, and they've been a little bit more organized than us, for many reasons, which we're not going to get into. But what they're showing is that transmission, the rates of efficaciousness for the Moderna and for the Pfizer are roughly the same as what they saw in the studies. This is that 95 to 95% between the two of them. And they also showing that transmission is very, very low after being vaccinated. So those are, really good things that we're taking information, we're extrapolating from to suggest that, we should expect the same things over here. So although we don't have that data yet, we're working on it, we can be comfortable or confident that, we have a better chance at, we're less likely to transmit. All right, so that should not be a reason not to get the vaccine. If you're scared that you can potentially pass it on, but you're still going to be protected. You're still going to get less likely of having symptoms, and by having symptoms, you're higher likelihood of passing on. So the protection you get is so much better than just saying I'm not going to get it at all because I'm scared I might still pass it. All right.
And then just to even, Dr. Johnson. Okay, I was just going to say, just to even piggyback, it almost comes full circle. So the idea of 2 weeks after vaccination, that you're able to be amongst people who can vaccinate really does support that, overall, we are able to safely be around, meaning that the chances of you passing it on is slim enough that we're able to make a national statement that 2 weeks after you vaccinated, you can be amongst other people who have vaccinated and safely, be in the presence and enjoy each other's company without all the full 6 feet apart, meaning that you can kiss your grandchild, you can hug your grandchild.
So I just want, if just for people who weren't able to attend our first live Q&A panel, could someone briefly on the panel just explain what exactly is an mRNA vaccine, what it does for people?
I nominate Dr. McPherson.
Yes.
I second that nomination, and I would echo that he would use his Snapchat analogy.
Yeah, and TikTok specifically, those explanations.
All right, hit it.
All right. So mRNA, as Dr. Uroda stated earlier, it's been around for almost 2-3 decades, the technology mRNA. Mm-hmm. mRNA, basically, it's a genetic code or sequence. Because we had SARS-CoV-1 in 2003, and just because we had, the recent one, China, they released the genetic code for the spike protein, which the spike protein is the most important protein on the surface of the virus. That's how it basically binds to our cells and does its damage. So what we were able to do with this technology is not give you COVID, what some people are going around saying, oh, they're giving you coronavirus. No, we were able to create the genetic code for the spike protein. And we engulf it in a lipid bilayer, or lipid, which basically is just fat globules. And then you add salt and sugar, which is just to help with buffering. Then now we are able to, once you inject it, the mRNA goes into your cell, and mRNA's job is to translate into protein. So mRNA, once it transcribes to a protein, the spike protein, it gets degraded. The example they were referring to is the Snapchat. You take a picture, somebody look at it, 10 seconds later, it's gone. So the same thing is with mRNA. It gets degraded once it does its job and creates the spike protein. Spike protein gets put on the cell surface. Our immune system is, whoa, I don't like that, homie. Let's go figure out what's going on. They go And in this process, they start creating antibodies, fighter T cells, dendritic cells. And that's another thing I always point out is the immune system is so complex. It's not just antibodies. Antibodies is the key, but you have memory B cells and memory T cells. The key, the key, they're called memory for a reason. They remember. So when you create them against to the spike protein, and let's say 2-3 years from now, you come in contact with it, the memory B and T cells say, oh, I do remember this. They'll trigger the whole immune response. You'll start creating antibodies again. So that's basically the mRNA technology. It does not alter your DNA. Like I said, once it gets into the cytoplasm, which is basically the inside of the cell, once it translates to the spike protein or protein, it gets degraded. So now you're just left with the spike protein, and now the immune system is going to recognize it, build all its army, as Dr. Lee Allen stated, build its army. So when you come in contact with it, you already have that army ready. They're already locked and loaded. What it does is, in simpler terms, is it gives your body a head start. Because when you catch COVID, COVID has a 2 to 14 day incubation period, meaning you can go, 3, 4, 5, 6, 7 days from exposure and not have any symptoms. But guess what the virus is doing while it's in your body? Replicating, taking over your machinery. And by the time you start getting symptoms, now your immune system is playing catch up. Like, oh snap, wait, what's going on? If you give yourself a vaccine and you build antibodies and those other cells I mentioned, you got a head start. Now when you come in contact with it, your immune system is already equipped to fight it off, which is why we believe that even though is a possibility you can contract it, even being fully vaccinated, that it's not effective. I don't think the transmissibility is very low. Once your body recognizes it and start beating it up, it's going, all right, I got to leave because I can't win this battle. And unfortunately, it might hop into another host that's unvaccinated or vaccinated.
And it's pretty much the kind of the same way, that the Johnson & Johnson vaccine works. The Johnson & Johnson is a little bit different in that you're kind of using the DNA for the coronavirus and kind of introducing it to the body so that the body can kind of make those spike proteins that trigger the antibodies to then, or create this immune response. Basically with the Johnson & Johnson, with it being different, we're pretty much just having our bodies do an extra step, basically, when it comes to forming those proteins and antibodies and everything. So it's pretty much the same way as how the Johnson & Johnson vaccine works.
Thank you, you guys. I want to move on to our next question because I see the questions piling up, okay? So our next one says, a friend of mine, their brother who lives in a senior citizen building was told by the health department that the shots last 6 months. Please address this if you will. Thank you.
I can quickly just a couple lines. Longevity, we don't have enough data to suggest how long immunity will last. We know that it's with the vaccines, and they're talking specifically about the mRNA vaccine. We're still waiting on information from J&J, but with the mRNA vaccine, Moderna, Pfizer, we do have some data suggesting that it will last and it can last up to longer than a year. Longer than a year. The projections they change as information comes in, but what that might mean is that if it should last around a year's time, you might need a re-up on the vaccination. You need to be revaccinated annually to keep that vaccination, to keep that immunity, okay? With the benefit of the vaccine, is that when you get that, you have a stronger, more stable immune response. So it may last longer than we would with natural immunity. Natural immunity, we know at least roughly around 3 months of protection that we can say, but we don't know if it goes beyond that. And not everybody has the same robust immune response. The vaccine tends to be just much more effective for that.
Thank you. So I'm going to keep it moving, you all, just because I want to make sure we get to as many questions as possible, okay? Next is, what are the hospital seniors doing to address clinicians who discriminate against the Black community? Are they being held accountable?
So I think if just my spin on this question is Dr. Uroda started out with saying, be your own advocate, right? So understand that there are a number of different channels, or I should say chains of command inside a hospital or healthcare system. One is patient experience. There is, if you feel like you have not gotten service correctly, or you feel in any way that someone has discriminated against you, or is not treating you to a standard of care, there is first patient experience that gets involved and actually contacts the doctor on your behalf and steps in. If you feel like that is still not enough, there is also the quality improvement officer that is in each hospital. And if you feel like that is not enough, then there is also, and I would say, take these steps, in order, give time, because, hospitals are still big systems. But if you honestly feel like you have been violated in any way, patient experience is first, and then the head of the, or quality improvement, there's also the head of the hospital. And then lastly, if you feel like a hospital system has not responded to you, then it is about time to step out into the state. The state actually has everyone who is regulated and licensed. You has someone that you can correspond with and discuss any grievances. So be the advocate, and we're here giving you the information on how you can advocate for yourself.
Thank you. Thank you. Miss Lori Slater wants to know, once you're fully vaccinated, can you be infected again with COVID?
Okay, I believe we answered this question earlier.
Very low, very low likelihood of it.
Okay, so we are going with that. And let me just see. So Mr. Jerry Williams, we have one of our other panelists joining in. He was delivering babies. It says that he's Randall McPherson. That's because Dr. McPherson sent his link, but that is actually Dr. Gini Ikwuezumma. He is our OB-GYN. Did I do it? I said it correctly.
You did. You said it perfectly.
I know, I practice all day. But thank you so much. He is an OB-GYN resident. And as you can see, he's still at work. So we really appreciate you logging on and joining us. Right now, we're just moving along through our audience questions. So
okay, fantastic.
What'd you say?
I say great.
Oh, okay. So Mr. Williams says, as the virus continues mutating, is the thinking that we'll need periodic boosters similar to the annual flu shot?
I can answer that really quickly. To start, they're both, I think all three, Pfizer, Moderna, and Johnson & Johnson have been in talks about a booster. Up to this point, I know that Moderna has taken, I believe they've already enrolled 60 participants that have received their full doses, first and second doses. They want to study a booster vaccine to specifically the South African variant as of right now. And I believe they're doing it in two ways. They're basically studying, they're wanting to essentially be able to eventually get out a booster vaccine, but then also a vaccine that combines what's already out now with the booster variant already built into it as well. So just kind of to reiterate, this is kind of one of the benefits of the mRNA technology of why it is so beneficial and crucial at this time, is that it is able to be quickly adapted to variants as they come out, much quicker than they had been before. So again, Moderna, I know, has taken active steps, and I know the Johnson & Johnson and the Pfizer are in talks. I'm not sure quite where they are on their process yet, but they're looking to do something very similar as well.
Anyone else want to add to that? Okay.
I would just echo everything that was just stated and say that the expectation is that we will be in a place where we will likely be immunized again.
Very good.
That's basically the expectation.
So I'm just trying to make sure that I'm reading people's questions correctly and making sure I'm getting it across. The next question is, are people being told that there are possible side effects in terminology that they understand?
I would hope that we are. Are people being, yes. So there is a difference between saying immunogenicity, or our expected response versus an adverse response. So when we're saying the common term being side effects, we're talking about the headache, the fatigue, the arm pain, the tiredness, and maybe some sweats at the most. But those are expected responses. That's what we call the immunogenicity, or our immune response that we want to expect to happen. So we're hoping that you'd have the arm pain. We're hoping that you have the swelling, and we're hoping that you have some natural response to something foreign being injected into you to create that immune response. That's what our white cells will do. That's a difference between you're having these adverse reactions, those unexpected responses, or those that have a history of having allergies to vaccinations. Allergies in the simplest cases, or the most severe being like having urticaria or hives, or requiring an epinephrine pen or EpiPen. Those are those that are having allergies or have had a history of allergies. And then we do have a place where, per the CDC.gov website, where you can report anything that is unusual after receiving first or second dose. And those are what's concerning adverse reactions. They could be any number of things. It is not expected that that would be the case. But if you do have a history of having any allergic reactions to vaccinations, would be the case. I'm going to step a little bit further and say, when we're looking at the Moderna and Pfizer vaccine, there is a component that is similar to what we find in stool softener Miralax, as well as what we see in Go Lightly PrEP, if you are those that are over the age of 50 and have ever had to have a colonoscopy. And if you ever had a reaction to those two things, then those will be the people that we're concerned with having a reaction to the Moderna and Pfizer vaccine. And that's the adverse reaction, being an allergic reaction.
I just wanted to make sure before we move along in our other questions, there's a clarifying question that one of our audience members just put in there. They just said that they read that J&J has the actual COVID virus in it, and the mRNA, Pfizer, Moderna does not. Can we confirm? This is very brief because we did answer this, but just flat out say yes or no.
The answer is no, that the Johnson & Johnson vaccine does not actually have the COVID virus in it. What it does is it has, it's taking an adenovirus, which is a virus that we see commonly during the winter season or whenever it decides to show its face, really. And it usually causes the runny nose and cold symptoms, and sometimes it causes actually conjunctivitis or pink eye. So they take basically that virus's outside shell, take all of the stuff that's inside of it out, basically, and then put just the DNA structure that will create the spike protein into that adenovirus shell. So then that goes into the body, and then that creates, the immune response, or the response we're looking for the protection against coronavirus. So it does not have the actual coronavirus in the Johnson & Johnson vaccine.
Thank you, Dr. Adu. So moving on to our
piggyback. Just quick, a piggyback off.
Real quick, because we're running towards the end.
Okay, piggyback off of Dr. Kenisha. For colonoscopy prep, Go Lightly. Just make sure it's 45 and older. If you are the age of 45 and older, particularly American, you would ask your doctor for your colonoscopy or other type of CRC screening. 45 and older. Okay,
I saw that. I got that too. Get together, Dr. Evans. But anyway.
I mean, I would be sending them to Dr. Lee Allen.
You're right.
That's right.
Anyway, for the procedure.
Do it. Okay, go ahead.
All right. Okay. So the next question that we have from an audience member, I believe this is a physician as well. They say that they practice in Atlanta, Georgia, and most of their patients are of lower socioeconomic status with large amount of low health literacy patients. What resources can they distribute, and how do we address this community regarding vaccine safety, efficacy, and increased vaccine uptake? We've kind of touched on a lot of those, so just very brief.
Yeah, so a lot of the information. So a lot of the information that's provided on the CDC.gov is actually written in a 6th grade level. So it's, it's been vetted, it's been, through the community and to be able to be understood by most individuals. So I would refer patients to the CDC.gov first, because that's going to have the most up-to-date information.
You can also
the
refer them to
WHO
our
website
website.
too.
Yeah, you can also
Right.
refer to our social media because
Yeah.
we have lots of things that, and we are always referencing CDC. In addition to
Absolutely.
that, has social media themselves, and that's Facebook as well as Twitter and Instagram. So
Yes,
Yeah.
share
And
our
the
live panel.
and the
Wait, hold on. Share our
and
live.
the WHO site too.
Hold
No,
on.
absolutely.
Hold on.
Yeah.
Hold on. Share our, like Dr. Lee Allen just said, share our past live Q&A sessions with your patients. A lot of people have access to social media, so sharing our YouTube videos. So once we are done with this, this is recorded and posted to our YouTube. The next question is, let me move on. So what are some of the common reservations and concerns and criticisms that you've heard expressed by your patients or people in your family about the vaccine?
Okay, I would say for me, things that I've heard from my own family and friends. I would say I've heard it all. I would say I've heard everything from that it was made quickly. I've heard everything that I've heard, yeah, it's made quickly. I've heard everything from just the distrust of it. I've heard everything from they would rather get the vaccine or get COVID themselves. I mean, everything that I've heard in the news, I think I may have heard from family and friends, to be honest. But I address those, I address them one by one as they bring their concerns to me. And, again, kind of what we said earlier, I just expressed to them that, as a physician, as a Black male physician, especially, one of my main reasons for coming into this role was for this very reason right here, was to, again, help to build that trust. I understand what the disparities are. I, have, a family that go through very similar medical situations and just life situations. So it's not like I'm oblivious to why, what the concerns are. But again, why I'm in this role is to be able to address these things head on from a point of true understanding, and to again help to build trust through knowledge, through teaching.
So one of the things that I hear a lot is, okay, doc, why I gotta take it? I take my CMOS in the morning, my vitamins, I keep to myself. What's the point of this vaccine? And my usual response is, right now, consider this a war. We are in a battle against a virus that we cannot see. And I like to go with a full shield of armor. So I am preparing mentally, spiritually, physically, for what we're facing. And I want to go in with everything that I've got. So I'm going to still take my vitamins. I'm still going to get my vitamin D levels up to where they need to be. I'm going to get my sleep, exercise, be as healthy as I can, and utilize the science that's out here to help protect me with this vaccination. So that's a huge criticism, huge thought. And with mutations becoming more contagious, some studies even showing more deadly with, certain variants like the UK. This is getting more challenging to fight with just, a mask and CMOS, not to speak against any of those things. I'm just saying that we have to go in with this mindset that we're facing something very serious and we should be going into battle with all that we've got.
I definitely agree. I agree, Dr. Uroda. The panelists have often heard me use this analogy of the seatbelt. We all have seatbelts in our car. I would hope so, unless I flash back to the 80s driving in an old Cadillac where there wasn't anything in the front middle seat. But anyway, so you wear your seatbelt. So just in the case that you get in an accident, your injuries are, not as severe. So it's the same thing when you're thinking about a vaccine. We're hoping that this is the best tool that we have in our toolbox to decrease the severity of the complications that you can get from contracting COVID-19. Okay, so let's see what's our next question. Do you guys see any other questions in there? I know something as a pediatrician, I guess I'm biased. I just want to talk about how is this affecting our children? What are some of the new updates that you guys have heard in regards to our pediatric population? Does Dr. Gu want to take that one?
So regarding our pediatric population, so right now, I think just as of today, we can vaccinate anybody 18 and up, right? 16 and up, 16 or 18 and up.
16 and up in Detroit.
Yep, in the Detroit area. They are currently doing studies on our younger population now, which is great, down to actually 6 months. So it's from 6 months to 12 years old is kind of the studies. Oh, actually no, 6 to 17 actually is kind of the studies that are going on right now. So we'll kind of hope for a vaccine by next year for them. Sounds really far because I know all these parents are like, I want my kids to go back to school, but they're still working on making sure it's safe for the kids. I do know a lot of the Detroit schools are trying to have the kids go back to school. But those are kind of like the updates for the kids.
And what about, I think some of our family medicine physicians can also address this. What are some of the anxieties that you've heard from parents about, and many of you are parents, about sending their children back to school? Like, what can we do to protect our children?
An important thing is, again, I can speak on that, is making sure that our kids are wearing their masks when they're going to school. There was a push to get a lot of the teachers and school staff vaccinated to prevent the spread, going to the kids, because the kids can't get vaccinated at this time. Well, the kids under 16 can't get vaccinated at this time. So for now, what we can do is making sure that we're all washing our hands, or the teachers or the school staff is washing their hands, wearing their masks. They did decrease actually the distance between the kids to 3 feet now instead of 6 feet like it used to be. But just, making sure that, that the air is being filtered properly. And if you are sick or you have come in contact, or if a kid has come in contact with anybody with COVID, that they are staying home and quarantining for 10 days before they go back to school.
I would just like to add to that. One of the principles behind the reason that this 3 feet rule as opposed to the 6 feet as an adult is because kids, when they project, when they cough, sneeze, talk, or whatever, their particles are not stretching to this 6 feet distance. So that's where that principle comes from. It's not to say that kids are less likely to spread the virus, because if you have been keeping up to date here in the state of Michigan with the UK variant, most of those that have had it is between the ages of 10 and 19 years of age. Another important point to make is that not only for teachers, but for parents to understand that if your kid does have symptoms of cold, any of those runny nose, sneeze, the mildest of symptoms, because we don't know if they're going from one child to another, is to making sure that with the mildest symptoms, keeping them at home would be the best bet. Particularly now that kids are not being vaccinated, and making sure that you do know about your kids' classroom. How are they? What are the preventative measures that are being implicated in the actual classrooms themselves? Making sure that they do have the appropriate ventilation. I mean, some of our schools in the Detroit area are older models. I know that they're the city and the state are doing the appropriate measures to keep those classrooms that are not well ventilated closed. They're actually closing some of those classrooms that have that capabilities, but learning that information, and for sure, if your kids are having even the mildest symptoms, keeping them home.
And then for those people that were wanting to, for those individuals that want to get vaccinated that may be pregnant, this may have been addressed, but, I would also advise that you go ahead and do that. A new study showed that there is some vertical transmission of some of those antibodies that give some immunity to the mothers, we think, that are vaccinated. with the vaccine when they're pregnant. So I would advise that you see your OB provider and consider getting vaccinated.
I do see we have another question from the audience. I just want to get to as we're winding down. It says, speaking of steps that other countries are taking to incentive, or I guess give incentive to citizens to receive the vaccine, are there any US plans in place to add COVID vaccine passports as seen in other countries? Have you all heard that?
I think New York is trying to do something like that, right?
Yeah, I heard that. I thought it may have been throughout the all of the airlines. So I think that they are working on that. I haven't heard that it's been officially implemented.
I do believe that it does, if you have your card, the vaccine card, when you do go get vaccinated, it does give you a little bit more than having to have that 48 hours of a negative test, because you actually have your CDC card.
Very, very good. The last question I see on here is, once vaccinated, do you think travel to South Africa and Europe with the variants is safe?
I mean, the variants are here. They are here. The state of Michigan is number 2 in terms of the number of UK variants. Not only that, we have our own domestic variants. California and New York, they have a high transmissible variant. Keeping up with the information that the CDC provides and explain, they have a really great explanations and areas that they're concerned with, what they look for when they're saying that this variant is here. It goes back to that principle that viruses don't follow the rules that one area of the virus is supposed to make an arm, it's going to make an arm. No, they don't follow the same rules as our DNA does. So it is a survival of the fittest. So while this goes to the point of, will we be in a place where we need to get vaccinated again next year or the year after? It depends on that immunized pressure. How much of us are vaccinated, this idea of herd immunity, that we don't allow the virus to transmit and replicate and change into something different or something new and unique. So yes, they are here already. They are present.
Very good. And so you all, we are winding down. I believe we have about 9 minutes left in our live Q&A. So if there are any more questions that the audience would like to hear, make sure you put it in the Q&A box. But I know that we also have a poll, a survey that we want to start. If one of our co-hosts could start that. Once that pops up for you on your screen, please take the time to answer that poll. I'm going to close it myself because I'm not going to answer it.
We just wanted to make one more comment too, Dr. Johnson, about the variants that, the vaccine, the Pfizer and Moderna has shown a lot of, strong data that supports that it is still efficacious against those variants. There's studies actively being done right now as well on several other variants. And then Dr. McPherson, you had some comments about Johnson & Johnson.
Even with Johnson & Johnson, it's showing that it's also good with the variants, and more so Johnson & Johnson with the South African variant, because those were some of the that was one of the areas that that they chose participants for their vaccine trial. So in all 3 of the vaccines are doing well against the variants. But like as Dr. Evans mentioned, viruses, they create variants by replicating. And like she said, it's the more people who are vaccinated, the less likely virus can enter in and take over your cell machine, take over your body and replicate. So it's one of those things that, like, well, we're just not going to get vaccinated, sit around. That is a nidus for variants, and you could potentially be harboring a new variant, as opposed to the more people that get vaccinated, then the less likely the virus can replicate.
And just a couple, 2 quick things about dealing with this vaccine and routine screenings. If you are getting other vaccines that are non-COVID related, so if you're going for your shingles shot, tetanus booster, CDC guidelines do recommend that you wait 2 weeks between getting your COVID vaccine. So please keep that in mind as you're timing and scheduling things. And also women, us ladies, if we're getting our mammograms, please note that the side effects of these vaccines, or I should say, response to the vaccine, excuse me, can cause swelling of your lymph nodes. And those lymph node swellings can show up on your mammograms. So to prevent getting that false positive, please make sure that you are waiting 4 to 6 weeks after your second dose of your COVID vaccine to schedule your mammogram, or getting your mammogram done entirely before your COVID shot, so that that's not a risk of happening. Okay.
Yeah. And also when you go and see that's perfect, Dr. Uroda. That actually happened. A patient came to see me and they had some swelling, and I, was doing their clinical breast exam, and I noted that they had some swelling, and they're like, oh yeah, I got my COVID vaccine. So, I mean, that's something important to tell your family practitioner or your obstetrician when you do come and get evaluated, because that can be kind of helpful for us for counseling you on, the next steps, like Dr. Uroda mentioned.
Just to add to those points, is also this idea that you've received in the series with the mRNA vaccine, Moderna and Pfizer, you've received the first dose and you actually contract the virus, or you get sick for any other reason. Now the recommendation is to wait 90 days post your being symptomatic. And if for any reason you were still hospitalized beyond that point, you still can complete the series by getting that second dose at your earliest convenience. It is not a matter of you having to repeat and start all over. No, whenever you are asymptomatic for whatever illness that presents to you, unfortunately, you can still be vaccinated. If you're hospitalized, if you have any if you have missed your second dose appointment for whatever circumstances that present itself, being able to get it at your earliest convenience is most important. Although we do have that 6-week mark, if you miss that, you can still receive that second dose if that happens.
So we have about 4 minutes left, actually, and I want to just give everyone a chance to make very brief closing remarks, because
we have make sure we 35 out of 45 people that have responded to the poll. If we could get all 45 people to answer the question.
Answer those polls, y'all.
That would be great.
That would be helpful to us. Thank you so much. Closing remarks. Dr. Lee Allen, would you like to go first?
Sure. I just want to say thank you for joining in and tuning in with us tonight. Certainly there's other things that you could have done, but being able to educate and discuss and ask your questions, we really enjoy doing this, and this is our service to you. I also want to say, if you work for a large nonprofit, large corporation, and you would like us to have this type of group or live Q&A session for your exclusive audience, let us know. Send us an email, youngblackphysicians@gmail.com, and we'll be able to talk about what we can do for that. Lastly, for so many of our videos that we are going to, we've been doing and will do in the future, if you'd ever like your business advertised or upcoming event, let us know, because that's something else that we can do as well. Just email us. And that's it for tonight, for me.
Thank you. And to Dr. Jeremy and Jermaine Hogstrom, do you want to give us some closing remarks about our social media that people can follow?
Yeah, so we have a YouTube page, Young Black Physicians, as well as Instagram and Facebook. So if anyone would like to follow us, we do put information on there. Also on our YouTube page, we have excellent videos that come out, and we're trying to help answer questions in regards to COVID, as well as just give general medical tips and information. So please check that out as well. Yeah, just like what he said, we post a lot of medical things to those sites. As far as anything that I have to say before we all finish talking here, For those of you that are still on the border, about do you want to get the vaccine, do you not? Again, that's what these, panels are about, is to help you to further educate yourself. And that's the biggest thing that we all push for, even in our own practice, is to give you the most information, most clarity, the most transparency that we can possibly give you, so that you feel as comfortable as possible. Again, even now is a time that I think there's been more transparency than ever in medicine as a whole, especially with COVID. So I think now would be the time to really seize that opportunity and take all learning opportunities that you can, to learn about the vaccines, to again make the best decision for yourself. Again, thank you all for coming. That's what I have to say.
Yes, thank you. I just want to close up with one statement. So on March 25th, 1966 in Chicago, at a press conference before his speech at the second convention of the Medical Committee for Human Rights, Dr. Martin Luther King said, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman, because it often results in physical death." So I really hope that, this was informative, and that you guys understood that we are a group of physicians who are working to dismantle systemic racism and its effects on patient care. Like we have all said, we want to continue to be transparent and offer you the information that we can. And so we hope that this was informative, that you share this with your family, and that it does restore hope that there are people fighting for health equity on your behalf. So please make sure that you join us and watch our videos on social media. Anything else, you all? No?
No, I would just say, the last thing I would just say is, the best vaccine you can get is the one that's available. So any place that you can get one, even if it's just a single dose, make sure that you just reach out and go get your vaccine.
All right, guys.
Hey, thank you guys so much.
Yes.
Bye.
Bye.